Now, World Diabetes Day occurs annually on the 14th of November, and this year's theme was breaking barriers, bridging gaps, calling for improved access to diabetes care. Now, the World Health Organization warns that the number of people with diabetes in Africa could double by 2045, reaching 54 million unless urgent action is taken. Now, currently, 24 million adults are affected, with half of them undiagnosed. Undiagnosed, I beg your pardon. Now, Dr. Mashidiso Moeti, WHO's Regional Director for Africa, highlights the strain that this places on health systems, which focus on infectious diseases and allocate only 1% of health budgets to chronic disease care. Now, the big question is, how can Africa effectively address this growing diabetes crisis and also ensure better care for all? Joining me on the conversation to discuss more on this, we have Dr. Nesochi Okeke-Igbokwe, CEO, Dr. Nesochi LLC, Internal Medicine Practice, New York City in the USA. We also have Olufemi Fasomade, Professor of Medicine and Consultant Endocrinologist, University of Lagos, and also Dr. Ejiofor Ugu, National President, Diabetes Association of Nigeria in Enugu, Nigeria. Thank you so much for joining us, gentlemen and lady.
Thank you for having me.
All right, so let me begin with Dr. Igbokwe. Now, the WHO has stated that the number of people living with diabetes in Africa could more than double by 2045. That's from 24 million, today to 54 million. What are the main factors driving this projected surge?
So the main factors that I believe are driving the surge is that there's an underlying lack of focus on preventive care in Nigeria. So when I am seeing any of my patients in the US, we typically have routine annual preventive health evaluations. These preventive health evaluations essentially give me the opportunity at least once annually to screen for various chronic diseases, including diabetes. So when we have this lack of focus on prevention in Nigeria, I think it sets the stage for patients who are walking around undiagnosed, essentially ticking time bombs, unaware that they may have this problem with diabetes. I think a second issue is lack of diabetes education in the country. We need to also focus on education, informing the population what some of these risk factors are for diabetes, because there are in fact certain risk factors that one has control of and other risk factors that you don't have control of. So for instance, risk factors such as family history, you don't have control of that. Risk factors such as age, the older that one gets, the more likely that they may be susceptible to diabetes. But the risk factors that you are able to control are things such as physical activity, adhering to a more healthy diet, and if one is a smoker, quitting smoking, that reduces the risk of diabetes. But there are multiple factors to keep in perspective, but for the most part, we need to start focusing on preventive health and additionally educating the public really about some of these risk factors about diabetes.
Oh, okay. Now, let me speak to you, Professor Fasomade. Now, Dr. Igbokwe talked about, the lack of focus on diabetes in Nigeria and also some controllable and uncontrollable factors. But, this year's theme for World Diabetes Day is breaking barriers, bridging gaps. What specific barriers do you see as the most critical to overcome in Nigeria and also in Africa in order to improve diabetes care?
You have in Nigeria and most of Africa is the fact that people are unaware of the condition. Most people do not even know they have diabetes, just as Dr. Nesochi mentioned, and that is a big barrier. You could only prevent what you know about. You can also prevent what you can see coming, but when you don't even have any awareness that you are at risk, and you don't even know that it's coming to you or it has already come, then that is a major problem. It is a big barrier. Then there is another barrier, which is myths. There are so many myths surrounding diabetes. I just recall a few days ago, I was talking to one of my patients, and she says, oh, I just don't want to develop diabetes because people that have diabetes are cursed. So when you have those type of myths, those type of misconceptions that diabetes can be as a result of a curse, or diabetes can be a result of a spell, or diabetes can be a result of witchcraft, then people will be looking in the wrong direction. Another barrier also is the fact that many people don't even have access to health care, meaning that many people don't even know where to go and check their blood pressure, their blood sugar, or any factor. Many people don't even know their weight. So that is a major barrier that quite a number of people do have, because it is what you know about that you can work towards preventing. And it's also when you have the right belief and the right education that you can work towards either mitigating the occurrence of something or reducing the impact. So those are major barriers which are in line with the theme for this year, that we need to break down these barriers. And the way to break them down is by improving awareness, improving education. And that's why on November 14th, in many cities, in many towns, people do a lot of community screening and a lot of community awareness programs just to highlight that diabetes is something that people should check for.
Absolutely. Diabetes is something that people should be wary about and also check for. Now, let me forward the next question to you, Dr. Ugu, if you can hear me. Now, in Nigeria, it is said that over 5 million people are currently living with this condition called diabetes, and likely to see a significant share of, the increase that's projected to happen. Now, what impact will this have on the country's healthcare system and also the economy if that happens, if the increase happens?
Thank you very much. Good evening, all. Please permit me to extend my warm greetings to my boss there, Professor Olufemi Fasomade, and other panelists. Well, the diabetes epidemic in Nigeria is an ugly reality that we are facing at the moment. And what we are witnessing right now has been described as a tip of the iceberg. As you rightly said, at least 5 million Nigerians are currently living with diabetes mellitus. And this has been projected to increase significantly in the coming years, because according to the World Health Organization, African region is going to experience more than 100% increase in the prevalence of diabetes mellitus, Nigeria inclusive. Now, the impact it's going to have on healthcare and the economy is not difficult to fathom. Right now, we have very weak healthcare system. Our primary healthcare is almost in shambles, with very few, out of the 274 primary healthcare centers in Nigeria or thereabout, less than half are functional. When I say functional, I mean having the requisite manpower and also essential medicines. And most of them are not equipped to manage diabetes mellitus. Most of them don't have facilities for managing diabetes and complications. Of course, we also lack manpower in terms of specialists available to manage diabetes in Nigeria, especially in rural areas. So as we witnessed an escalating rise in the prevalence of diabetes mellitus, it is expected that even the current weak health system is going to be overwhelmed. We are going to experience more people coming with diabetes-related complications, like foot ulcers, kidney damage, blindness, and there are very few manpower available to handle all these complications. And the cost of care is also going to significantly increase, because we are talking about the economy, the impact is going to have on the economy. The cost of care is going to significantly increase, because it's been shown all over, it's been demonstrated all over the world that managing diabetes complications is much more expensive, 5 to 10 times more expensive than managing uncomplicated diabetes. Just imagine somebody who develops diabetes nephropathy and kidney damage. The amount of money the person is going to be spending on hemodialysis, renal replacement therapy, or even kidney transplant is far much more than a lifetime cost on uncomplicated diabetes. The same thing, it's been shown all over Nigeria and all over the world.
Absolutely.
The cost of managing diabetes ulcer is also much higher than uncomplicated diabetes. So it's going to wreck the Nigerian economy if nothing is done. Then what about the loss in manpower? Of course, people who have diabetes complications, those who are blind, those who are amputated, those who have kidney problems, they are not going to contribute to the national GDP, national income. You are going to see people who are going to be laid off from their workplace, people who are going to have difficulty in securing employment, people who find many of those people are breadwinners in their homes, and you can imagine the catastrophic consequences, the ripple effect that this is going to have, because by the time the breadwinner with diabetes loses a limb or dies or becomes blind, then it trickles down on every member of the family. So the impact is going to be grave.
Okay, let me hear what Dr. Ibokwe actually has to say about this. I know Professor did talk about the fact that so many Nigerians are even unaware of the fact that, they have diabetes. And, reports actually say that half of the 24 million adults with diabetes in Africa are undiagnosed. Now, what do you think is contributing to this high rate of undiagnosed cases, Dr. Ibokwe?
I think the fact of the matter is that the healthcare infrastructure in Nigeria is extremely poor. It's extremely fragmented. It's extremely damaged. And quite frankly, it's in need of a makeover. It leads the average Nigeria to be sort of battling survival on a day-to-day when it just comes to health and health outcomes. So I think that's really what is driving a lot of these undiagnosed cases, just the infrastructure of healthcare in the country. I think there need to be strides from government to implement more strategies, more funding in the healthcare system so that every Nigerian has access to quality care, has access to preventive care. Right. Healthcare in Nigeria needs to be deemed a human right. Every Nigerian should have that access so that they could have the ability to see their doctor at least once a year for just preventive screening. If we don't have some of these actions in play, then it's a recipe for disaster. It sets up the stage for all of these individuals with undiagnosed chronic illness in the country.
Okay, Dr. Ibokwe, but it is actually said that, our health systems are traditionally structured to focus on infectious diseases, leaving the chronic conditions like diabetes underfunded. What are your thoughts on this?
Yeah, so that's an inherent issue as well. You can't just focus on one specific aspect of health. Infectious disease, though important, chronic care is also important. Basically taking care of chronic illnesses like diabetes, like high blood pressure, cardiovascular disease, that's extremely important. If we're just focusing on disease outbreaks, infectious disease, you're leaving out a whole spectrum of different diseases that overall will increase healthcare costs for all. It's better to focus on prevention, also include the aspect of preventive care in addition to looking at the public health aspect of infectious diseases to ensure that we can pretty much optimize healthcare outcomes for all Nigerians. So we have to focus and look at different aspects of health in order to really optimize one's health.
Okay. All right. Now, let me still ask that same question to Professor Fasomade. Now, diabetes care is actually said to currently receive only 1% of Africa's health expenditure. That means they're focusing more on pandemics and infectious diseases rather than, chronic conditions. Now, what immediate changes, are needed to address this gap?
Well, the first change that needs to be put in place to address the gap is to improve healthcare funding. Some decades ago, it was decided at the Abuja Declaration that health should attract 15% of national budgets in African countries. But we have seen that even Nigeria, where this agreement was made, we've never reached 8% in the past 2 decades. Healthcare budgets usually hover around 4 to 5%, and that is a major case. So overall, health is underfunded. And even when you see apparent better funding in things like the communicable diseases, these are from donor funds. Things like polio eradication, hepatitis eradication, HIV eradication. Most countries in Africa just depend on the WHO and other foreign aid organizations to help them with this. Even when it came to COVID, most of the funding came from outside. The governments themselves did very little. So that is a major problem. The governments need to increase the budget for health and then to take a sizable portion of that and apply it to chronic diseases. That is the only way to increase the infrastructure. For instance, a person coming into the emergency, not only should he have his blood pressure checked, not only should he have his temperature checked, every person should have their blood sugar checked. Those are simple ways of increasing awareness. Those are simple ways of catching them early and preventing these cases from getting to stages where they are very, very complicated. So the funding needs to increase. Even in the health insurance scheme of most African countries, including Nigeria, you find out that, first of all, the coverage is abysmally low. And then when you now come to the specific conditions like diabetes, you find that so many of the medications and the treatments that are required are not covered. So those are multiple problems that need governments to change their policies, improve their infrastructure, improve the funding, and also make sure that there is an enabling environment for every person to have his blood sugar checked, either at the community level during community screening or during opportunistic checking when the person comes into the hospital for any other condition, including antenatal care, pre-employment screening, or treatment for any other condition. These are the ways that most other countries have been able to increase the number of people that are diagnosed. Most African countries today, just about 20 to 30% of them have the people that have diabetes knowing that they have the condition. Many of them have undiagnosed cases, up to 70%. And these are a major problem. And that is why when they now come with all the complications, they present as tertiary care, where again, they don't have the funds to take care of them. A person with a minimum wage of 70,000 naira can't afford even one session of dialysis, not to talk of one amputation, which costs millions in terms of treatment and rehabilitation. So the place to go for government is to improve the awareness, to increase community screening, opportunity screening, and then to make sure that at every primary health center, there is a facility to check blood sugar, to check urine sugar, to ensure that anybody that comes inside has a fair idea of whether he or she has diabetes or is at risk of developing diabetes.
Okay. All right. Now, Dr. Ugu, earlier, Dr. Ibokwe said that, government needs to come in, especially when it comes to, funding diabetes care. And we all know that Nigeria's healthcare system, is under strain with limited resources allocated to, such of these chronic diseases like diabetes. And we also know that only a fraction of the national health budget is dedicated to non-communicable diseases. So how can Nigeria or the government resource to ensure better care for people with diabetes?
Thank you very much. The last speaker has already enumerated a good number of them. It is no longer news that healthcare funding in Nigeria is very, very low, grossly inadequate, and especially in the area of non-communicable diseases. Now, when it comes to diabetes, there are specific things that we expect the Nigerian government to implement to be able to bring down the cost of managing diabetes, which currently is so exorbitant and beyond the reach of an average Nigerian. One of the things that we recommend is an urgent and immediate subsidy on diabetes medications and consumables. Now, the last speaker talked about the funding that is directed to chronic infectious diseases like tuberculosis, leprosy, HIV, and all that. So a lot of money is being pumped in this direction, infectious diseases. However, it is instructive, it's noteworthy that diabetes claims more lives in Nigeria and most African countries than most of these infectious diseases, including tuberculosis, malaria, HIV, all combined together. Yet, there is almost 100% subsidy on these other infectious diseases. Like in Nigeria, HIV treatment is free of charge. The same thing with treatment of tuberculosis. But diabetes medications, the prices are escalating on daily basis, and it has made it extremely difficult for patients to be able to access care. So government needs to, as a matter of urgency, subsidize the cost of diabetes care in Nigeria. That will go a long way to ensuring increased affordability of care and then making sure that more people are able to access quality diabetes care with a view to reducing acute and chronic complications of diabetes. Now, the other thing is we also recommend, we suggest that the federal government of Nigeria should implement the tax duty-free policy that the President President Bola Ahmed Tinubu has already given an executive order. We are aware that an executive order has been given that pharmaceutical products should receive duty-free tax. So if this is implemented, but we don't know, we are not aware that implementation has begun. To the best of my knowledge, it's yet to take effect. And when this thing is implemented, it will help in reducing the landing cost of these medications, thereby bringing down the price. Then, in the medium to long term, we'll also advocate that Nigerian government should create an enabling environment for indigenous manufacturing of diabetes medication. Almost all the companies, manufacturing and marketing diabetes medications in Nigeria are all foreign companies. So most of the time, their pricing is also done in dollars, according to their indigenous companies, and then the cost of importation, and by the time the medication go through all the middlemen or the processes, we discover that it's coming at a cost that is prohibitive for an average person living with diabetes in Nigeria. So we need to encourage indigenous manufacturing by giving them incentives in terms of social amenities and also security to be able to start manufacturing these medications locally, as it is done in India, it is done in China, it's done in Pakistan, and many other countries, right? So, and in addition to that, if you go to Egypt, for instance, there is a partnership between the Egyptian government and Eli Lilly. Eli Lilly is one of the biggest makers of insulin all over it. And through that partnership, Eli Lilly is able to establish a factory in Egypt. And because of that, insulin is almost, free in Egypt. In fact, in ministry health hospitals in Egypt, insulin is free. So Nigerian government should also consider going into such partnership as a matter of urgency with all those big farmers like Eli Lilly, like Novo Nordisk, Sanofi and all that, to bring home their manufacturing plants right here in Nigeria and then give them all the enabling environment to be able to produce these medications.
Okay.
So until these things are done, the current situation is very, very pathetic. All right, more than 400% increase in the cost of diabetes medication has pushed so many people out of treatment, and many of them have resorted to alternative medicine, and of course, we know the potential consequences of this type of.
Oh, okay.
Thank you.
All right. Let me come back to Dr. Igbokwe. Now, let's talk about the stigma surrounding diabetes. How does this affect the willingness of individuals to seek diagnosis and also treatment? And I would also love for you to talk about this as well. A new global survey by the International Diabetes Federation, revealed that 77% of people living with diabetes experience anxiety and depression, due to their condition. While you talk about, what do you call it, the stigma that comes with having diabetes, also talk about, how mental health, support can be integrated into diabetes care in Nigeria.
Okay, so essentially, stigma is ultimately a barrier to getting the care that one requires to adequately take care of diabetes. When there's this stigma or these negative attitudes or judgment or discrimination based upon a diabetes diagnosis, it hinders one from actually going to get the care that they need because they feel that there's this perceived negative judgment about them that perhaps they did something wrong in order to acquire this chronic disease. With that said, we need to debunk a lot of the myths associated with diabetes, because once these myths are debunked, those negative attitudes, that stigma can start being removed from any chronic condition, especially diabetes. I think when there's more education and more understanding of the disease process, it removes that layer of stigma and it enables one to want to move forward with the treatment and care of the condition. In regards to the mental health aspect and the mental health piece of diabetes, yes, studies do show that individuals with diabetes actually experience more depressive and anxiety symptoms than others. They have an increased rate of depression or anxiety. So with that said, there must also be a focus on not just physical health, but also a focus on mental health. In Nigeria, we also know that that stigma exists in regards to mental health concerns. So again, we also need to remove the stigma that's associated with mental health in the country. Patients need to be screened routinely for depressive symptoms, for any mental health conditions, in order to help improve the overall outcomes that they can have with living with this chronic illness.
Okay. Well, thank you so much, Dr. Igbokwe, for that. Now, let's come back to you, Professor Fasomade. Now, earlier, Dr. Ugu talked about, the cost of diabetes care in Nigeria being very high. Particularly, you also talked about, how expensive it is for rural areas. Now, what can be done to make the management of diabetes more affordable and accessible for Nigerians, regardless of income or location? And I'm asking if mobile health solutions or even community health workers can actually help bridge the gap.
Yeah, thank you. That's a very good question. In the first instance, treating diabetes is very, very expensive, and that is probably related to the fact that 90 to 95% of medications that they use are all imported. And with the devaluation of the Naira, the prices of these agents have skyrocketed. So some of the ways to reduce the costs is what Dr. Ugu mentioned, and that is to make sure that they are manufactured locally. The second way is to remove all taxes, either on the finished products or on the excipients or anything that is used in the manufacture of diabetes. Another way to make sure that you can reduce the costs for those both in the rural and the urban areas is to make sure that if you can't get them to prevent the diabetes, you put in place a secondary prevention so that they don't have other complications of diabetes, which are usually where the escalation in cost comes from. Because ordinarily, a typical patient who has diabetes that is fairly well controlled and is caught quite early, he might be able to get away with using medications of between 20 to 30,000 naira per month. But where he lets it go out of hand and he now has so many medications to use for blood pressure, for kidney issues, for eye problems, for foot problems, that cost can go up 10 times. And then when you have complications like visual complications, blindness or partial sight loss, or kidney failure or a leg ulcer, then the cost really goes out of the roof. So the first thing is to make sure that you prevent the condition. And that's where the village health workers and the community health officers will come to bear, because you can prevent diabetes from an early stage. Right from childhood, you could ensure that children eat healthy, that they have healthy weights, that they don't have an extreme of any weight in the childhood period or infancy, because children who are underweight at birth or in early infancy also have a risk of diabetes.
Of course.
Likewise, children that are overweight or obese. So child nutrition, maternal health, these are very, very important places where you can start to prevent diabetes. And then also talking about it in the community, letting people know the importance of taking a balanced diet with adequate quantity of fiber inside, and to avoid carbonated soft drinks, refined carbohydrates and sugars, and other things that promote obesity and indirectly diabetes. So these are different areas where the cost can be reduced by having the people diagnosed quite early.
All right.
Thank you.
Well, thank you so much, gentleman and lady, for joining us to speak on this very, very important topic. Dr. Nesochi Okeke-Igbokwe, CEO, Dr. Nesochi LLC, Internal Medicine Practice, New York. Professor Olufemi Fasomade, Professor of Medicine and Consultant Endocrinologist, University of Lagos, and also Dr. Ejiofor Ugu, National President, Diabetes Association of Nigeria, Enugu, Nigeria. Thank you so much once again for your time.
Thank you for having me.